An elderly 81-year-old female ate undercooked pork while on a trip to her hometown village in Mexico. This is how it led to a seizure and a broken hip. Hey, Dr. Nav here. The case report we're about to discuss is based on a real patient, and the complications we'll mention are also very real. It's important to note, this video isn't meant to scare you. If you live in the United States, most USDA inspected meats are safe to consume if they're prepared and cooked properly. However, in the developing world, the condition we're about to discuss might account for up to 30% of epilepsy and seizure cases in countries where this parasite is endemic.
They gave us pork and pig intestines. Shit you discarded that we ingested.
LF is an 81-year-old female who presents to the emergency department after sustaining a fall. She's confused, disoriented, and unable to answer questions. Her daughter mentions to the admitting physician that she found her on the ground this morning with her eyes rolling to the back of her head, shaking violently, breathing erratically, and she even lost control of her bowel and bladder function. Several months earlier, LF went on a trip with her daughter to visit her family in her hometown, a small village located outside Mexico City. One afternoon, she was on a walk and was offered some carnitas tacos from a local street vendor. She recalled growing up and eating these tacos as a kid. She wanted to see if they tasted as great as they used to. So she bought a taco, and to her surprise, when she took that first bite, she was amazed at how tender the meat felt inside of her mouth, like a medium rare steak, and the flavor was out of this world. Better than she ever remembered it as a kid. She could feel a tingling sensation, almost as if something was nibbling on the sides of her cheeks. After eating the taco, she felt good. Around 3 to 4 hours afterward, she thought she felt something weird in her stomach, but didn't think too much of it. The following week, she would have these tacos during her afternoon walks a couple times per week, and she would safely return back to her home in California. As the days passed, LF would feel kind of strange at different times. Some weeks, she would have nausea that wouldn't go away. It would be accompanied by itching, a runny nose, watery eyes, and sometimes even a low-grade fever. Every now and then she had bouts of diarrhea, but they would resolve. She went to the doctor and she shared these symptoms. She was given an allergy medication since it was allergy season. One day she used the bathroom and she looked at her stool. She noticed something she had never really seen before. She noticed what appeared to be little grains of white rice that were floating around, and they even appeared to be lodged inside of the stool. She didn't think too much of it at this time. She washed her hands and then went to go make herself a sandwich. Over the next month, her daughter noticed she seemed increasingly confused, disoriented, and even complained of dizziness when she would stand up. She complained of a headache that was progressively getting worse and was now a constant throbbing sensation. She also mentioned daily muscle pain and aches, and even started noticing lumps popping up under her skin. One morning, she felt like her head was heavy. She got up to use the restroom, but she fell and she ended up hurting her hip. Her daughter hadn't witnessed the fall, but she heard a loud thump in the house, and she made her way to her mother. She noticed that she had vomited, appeared confused, and then her eyes rolled to the back of her head, and she began shaking uncontrollably. She even lost control of her bowel and bladder at this time. Her daughter Jill called 911, and the ambulance brought her to the emergency department where we are now. At examination, she was confused. She couldn't remember the date or where she was, and she appeared more tired than usual. Blood pressure is 80/50, heart rate is 110, in sinus rhythm when you obtain the EKG. She has a fever of 102 degrees Fahrenheit. You notice she has several lacerations around her tongue, and her clothes are soiled with urine. You notice a leg length discrepancy when evaluating her feet, and she's unable to move the left hip. There's no apparent head trauma or lacerations, She doesn't appear to have neck stiffness, which would have pointed towards something like meningitis. However, you do note multiple skin-colored subcutaneous nodules or bumps that are present on the neck, back, legs, and arms. But her daughter confirms she definitely was not responsive when she had the shaking episode. Jill reports the constant headache her mom was having and even mentions over the past few months she hadn't been feeling quite like herself. She's confused why allergy and pain medications hadn't really helped, and she asks you what you think might have caused this. You note that the reported shaking episode and the headaches might point towards something in her head, and that her exam is also concerning for a left hip fracture. You order imaging to help explain these findings, as well as blood work to evaluate whether she's losing blood or having organ damage. The fever could mean some type of acute infection was driving this process, so you've ordered blood cultures. You're checking her white blood cell count, which can be elevated for a number of reasons, one of which could point towards an infection, as well as obtaining a urinalysis as a part of your infectious workup. You explain to Jill, one thing you know for certain is that she had a syncopal episode, which is an umbrella term for somebody who loses consciousness and faints. The most common causes of syncopal episodes can be things like a seizure, low blood sugars, underlying infections, heart arrhythmias, dehydration complicated by low blood pressure, also known as orthostatic hypotension, or failure of autoregulation of the blood pressure from something called vasovagal syncope. You're concerned about the episode of vomiting that she had and mentioned to the daughter they're getting a chest x-ray to make sure she hasn't aspirated some of the vomit, which can sometimes lead to aspiration pneumonia. You reassure the daughter that her mother is in good hands and that you'll order the appropriate test to hopefully pinpoint the etiology of this syncope, and that you suspect something caused what appeared to be a seizure due to the history of convulsions, the tongue lacerations, what appears to be a post-ictal state where she was a little bit more confused than usual, and a loss of bowel and bladder function that we saw when her clothes were soiled. Part of your workup is blood cultures, a complete blood count, a complete metabolic panel to assess liver function and kidney function, a PT-INR to see her bleeding status, a magnesium, and a lactate. You tack on a chest x-ray, hip x-rays, and a leg x-ray to evaluate further for fractures and for pneumonia, head imaging to evaluate for a bleed, and possibly other causes to explain what's happening. You obtain an echocardiogram of the heart, which is an ultrasound of the heart to see if she's having any abnormal findings. You're getting orthostatic vital signs, as well as an EEG, which can tell us if she's having a seizure. In the meantime, you give her IV fluids, pain medications, and after the blood cultures are drawn, she's given broad-spectrum antibiotics due to her fever and concern for a possible infection. Blood work returns showing an elevated lactic acid, suggesting her organs may not be adequately receiving oxygen. Her creatinine is elevated due to a likely acute kidney injury, and she has a high white blood cell count with a normal hemoglobin. That's at her baseline when you review her primary care doctor's records. The high lactic acid with a high white blood cell count could mean that her immune cells are fighting an infection, but it could also mean that this was in response to the stress that she just had occur after the fall. Fortunately, she wasn't having an internal bleed because her hemoglobin is at her baseline, but she was likely dehydrated, and the history of vomiting could help to explain a hypovolemic pre-renal acute kidney injury. The x-rays come back and it shows us this acute left-sided femoral neck fracture. And incidentally, you detect hundreds of these small tissue calcifications that resemble specks of rice grains. Her head CT did not reveal an intracranial bleed, but the radiologist mentions multiple calcifications and what appears to be multiple cysts in different stages that are lodged inside the brain and in the eye muscles. The radiologist recommended a follow-up MRI for further characterization to detect swelling around these calcified lesions. Once you see these findings, You're able to narrow down the differential because these findings are pathognomonic for parasitic tapeworm infection, and the patient's recent travel history favors this as a possible culprit or etiology for her presentation. Further evaluation shows the cysts had disseminated into nearly all of her muscles. A stool sample from the patient confirms Taenia solium tapeworm infection, suggesting that all of this began from the ingestion of infected pork meat that was undercooked and from the ingestion of tapeworm eggs. When you ask the daughter about any pork ingestion, she recalls the carnitas tacos from the local vendor and even recalls that many of her family members have been complaining of these vague signs and symptoms as of late. When you share the x-ray with the daughter and show her those rice grain calcifications, she even mentions that her mom had said that she saw specks of these type of grains in her stool. Evidence suggests that the domestication of pigs occurred around 9,000 to 10,000 years ago. Our close proximity to them has made for special developments. Our stomachs are a definitive host for a tapeworm called Taenia solium. Accidental ingestion of this worm most commonly occurs from the ingestion of undercooked or raw infected pork meat. This infection is called Taeniasis. The worms have these spikes called scolex that can attach to your bowel walls, and they can grow larger by feeding off of your diet. They can even grow up to 20 to 40 feet long. The adult tapeworm develops by forming proglottids, which contain tapeworm eggs. The adult tapeworm can survive for years in the small intestines. Most human infections are with only one or a few adult tapeworms. As they mature, their segments are displaced and pass through the stool of the human host. This can allow them to spread in the neighboring environment. One tapeworm is known to be able to produce as many as 50,000 of these eggs, and when they're passed through the stool of an infected person, they can go on to infect other animals as well as other humans. On farms, pigs can ingest these eggs by eating vegetation that's contaminated with them. When those eggs hatch, they penetrate the pig's intestinal wall and circulate into their muscles. When we eat meat, we are eating muscle, and this is where the exposure and the infection happens. This means it wasn't grains of rice that grandma saw in her stool that day, it was pork tapeworm. In the United States, rigorous agricultural policies, standards, and enforcement have successfully prevented the transmission of Taenia solium in pigs. Strict sanitation, hygiene standards, and thorough slaughterhouse inspections ensure that consumers purchasing USDA-inspected pork are unlikely to encounter Taenia solium or its counterpart Taenia saginata, which is the beef tapeworm coming from cows. The prevalence of these measures in legally USDA-inspected foods, coupled with the overall high standards maintained by certified vendors, makes this infection extremely unlikely to come from US-sourced pork. This is why deworming practices is not common in the United States. The tapeworm LF has infected her specifically because she ingested undercooked pork, and cooking it may have prevented this infection. It turns out that many of her family members who also ate the tacos had similar complaints about their stool after also having a low-grade fever that would span on for a couple weeks. But this doesn't explain LF's seizures or those cysts seen in her muscles on the follow-up imaging. Her MRI revealed multiple lesions representing viable cysts. The parasite wasn't just in the GI, it was in her muscles, and multiples of them have lodged into her brain and had been living there for some time. Just eating undercooked infected pork does not lead to muscle and brain cysts, but rather, it comes from the ingestion of the rice grain-like eggs we discussed earlier. When pigs ingest these eggs, they migrate to their muscles. But when humans eat them, they migrate to the muscles and the brain by invading the bowel wall, entering small blood vessels, and then disseminating into striated muscles, liver tissue, and other tissues, including the brain. In LF's case, the findings of these cysts all through her musculature and in her brain meets the criteria for extensive disseminated cysticercosis, a condition that's only been reported less than 150 times worldwide, making her one of the rarest presentations in the United States. These little cysts can develop in as short of a time span as 3 to 8 weeks, as we see on imaging. For the eggs that cross the blood-brain barrier, they can hatch in the brain, causing neurocysticercosis. These eggs go through multiple phases before they become viable cysts that mineralize and appear calcified on imaging. This calcified stage can cause recurrent seizures due to the fact that a calcified dead parasite is lodged in and stuck in the brain. Recall the day LF looked at her stool and then made herself a sandwich. It turns out she hadn't washed her hands properly after using the bathroom, and when she prepared the sandwich, her hands were contaminated with the pork tapeworm eggs, and she accidentally ingested them when eating the sandwich, causing an auto-infection. This is called fecal oral contamination because she had indirect contact with her stool, and she ate the eggs. Hands that touched the part of the body containing the Taenia eggs touched the food that ended up in LF's stomach. It's not enough that she ate infected undercooked pork, but her muscle and brain infection was coming from consuming Taenia eggs directly, meaning LF was infected twice by different forms of the same tapeworm. This is an important distinction. The intestinal form of the tapeworm is from eating undercooked infected pig meat. The muscle and brain infection, Cysticercosis and Neurocysticercosis, is from eating parasite eggs from a human who has the intestinal tapeworm, meaning you're coming into direct or indirect contact with your own, such as LF's case, or someone else's feces, and ingesting it. Or you or someone else touched around the butt area, where the Taenia eggs are sometimes found in an infected individual, then touched something else. And just by touching that same area and making contact to the mouth, it can lead to the eventual brain infection. In certain cases, these eggs can remain viable for weeks and sometimes even months. If COVID wasn't enough of a reminder to wash your hands, I have a strong feeling that this will. As discussed before, this is not common in the United States from USDA inspected meat, but it is endemic in many regions of Central and South America, Sub-Saharan Africa, India, and Asia. Neurocysticercosis is a common cause of seizures in these regions. It's approximated that 30% of those who have seizures in these regions have cysticercosis infection. The prevalence of this varies and is often higher in rural and pre-urban areas, especially where pigs are raised and where sanitary conditions are suboptimal. As the medical team evaluates LF's situation, she receives a total hip replacement for her fractured hip. The ID specialists treat her with 2 antiparasitic medications. One medication for the gut infection, praziquantel, which forces calcium into the worm, forcing its muscles to contract, paralyzing it, getting its suckers to detach and dislodge from the GI system. The other medication, albendazole, destabilizes the parasite and starves it, depleting it of energy. When the parasites react to this treatment, it triggers inflammation that can cause swelling, and in her case today, we're dealing with brain tissue. LF is also initiated on corticosteroids to limit the immune response and limit brain swelling. She's also started on anti-seizure medication to prevent another seizure from happening. The infectious disease team also recommends an eye exam prior to initiating treatment to exclude ocular cysticercosis, which can threaten vision. They also recommend screening for latent tuberculosis, as well as screening and empiric treatment for other roundworm infections, since she'll require corticosteroids, and this can lead to the reactivation of these bugs. After LF surgery, she was observed and treated in the hospital for a few more days. She did not have any additional seizures, and her neurologic exam appeared to be normal. She began being able to answer questions appropriately and initiated her physical therapy. She was discharged to rehab and eventually made it home. Several months later, she was noted to be seizure-free and it appears she made a full recovery. Follow-up imaging showed that she had complete resolution of these cystic lesions. This is a great example of why certain cultures recommend against the consumption of pork and perhaps even other meats. This was a great case that highlights the atypical presentations of older adults, specifically what doctors call geriatric syndromes. Many times when the underlying cause is treated, you might see grandma or grandpa go back to normal. Sometimes this can take a little bit longer than it does in younger adults, but it's a reminder that older adults can present very differently, such as in this case where a neurocysticercosis infection led to a seizure which led to a hip fracture. Below you'll find 4 evidence-based steps that you can take to prevent infection from parasites. Feel free to pause and take a screenshot. Hey everyone, I'm your host Dr. Navbadesha. I'm a double board certified physician, and we just started this series to help make education a bit funner and more intriguing. If you guys enjoy this, be sure to give it a huge thumbs up and please smash that subscribe button. It really helps our family grow. Thanks for watching, take care of yourself and be well.
To this day, grandma afraid what I might say. They gonna have to kill me, grandmama, I'm not their slave. Check out the bazaar.